now let's move on to healthcare. And obviously a lot of people are scared that the government's going to take over healthcare. But interestingly enough, government-run healthcare programs like Medicare already make up 46% of healthcare spending in this country. And the Department of Health and Human Services, they did a customer satisfaction survey of people that buy into different health insurance plans. And they found that people that had Medicare plans rated their healthcare between 9 and 10. That's 56% of Medicare recipients rated their healthcare on 9 to 10 on a scale of 10 being the best healthcare. And that's compared to only 40% for people that had private health insurance. So you have essentially 16% more people who had Medicare thought they had excellent health care. So doesn't that kind of undermine the argument that the government just can't run a healthcare system? Kyle?
I think the argument that the government can't run a healthcare system is flawed because we have governments, we have socialized medicine in other countries that have successfully run the country. And I understand you really can't equate one country with another. I understand that argument. And in a way, that is a valid argument. But there are so many areas of research that have shown that we have the capacity to do this. We have the ability in us to do this. The majority of Americans support a national healthcare plan that will cover everybody. It's just, how do we implement this policy? And that's where we're running into the skids.
So Andrew, do you agree that other countries have successfully implemented a government-run medical system?
Absolutely not. I mean, if you go to Canada, if you want to get your cholesterol checked, that's a 3-week wait just to tell you that. And in fact, if you ask the people at the desk, well, is there any way I can get in sooner? They'll tell you to go to the private clinic because they can get you done that day. The thing is, with this Medicare, Medicaid stuff, that's a very much smaller scale than what we're looking at than putting the public option in, where you have huge numbers of people putting a strain on this healthcare system. And as part of it, Obama's promising more benefits at lower cost, which is something that absolutely defies logic. The only way that can happen to get more people covered at lower cost is to reduce the quality or to ration it.
Mm-hmm. So Kyle, what do you think about the whole claim that the government-run healthcare will cause rationing, that there will be waiting lines? People, they cite Canada's healthcare system, that people have to wait in lines for all these operations. Is that a real problem?
I actually found a study by the Commonwealth Fund that actually looked to see if the waiting period is a problem. And what they came up with was, yeah, Canadians do wait longer for surgery. It happens to be discretionary surgery is actually what they wait longer for. Same thing, well, in Britain, Germans and French actually have no delays in their own healthcare compared to us for any surgery. So what they're finding is that, and especially also Canadians wait longer for hip replacements than we do, which would make sense though, because hip replacements are one of the primary issues for Medicare, which is, as Andrew says, a smaller, more efficient little system than the Canadian system is. So will it lead to rationing? I honestly don't believe it will. I believe that the studies are actually showing that this whole waiting game is being played up, and it's being very selective in what they're choosing to say people are waiting for, and that's just not what the reality is saying.
Obama has said that the healthcare program he wants to pass wouldn't add a dime to the deficit. Andrew, do you think Obama's telling the truth there? Or is this one of those you lie moments?
You lie! No. Every politician who has ever come along has said, my plans are not going to add to the deficit. Some of them promise that they're going to lower the deficit. This is Republicans including. They all lie. No matter what politician is in charge, the deficit is going to grow, spending is going to grow. That's just a fact of life. It's unfortunate, but it's just a fact of our political system as it stands.
So Kyle, would you agree? Do you think it's possible to pass this plan without racking up deficits?
Again, weird coincidence. I do believe politicians are all full of shit. And to say that this is not going to add some deficits, there's a lot of shades of gray to this, but ultimately there needs to be some taxes. There needs to be taxes being raised if you want a pure universal system, which is not going to happen. Let's be perfectly clear. People are not going to want their taxes raised, especially in this economy. We're in the craps. That's given. So there are ways to go around this. Letting the Bush tax cuts expire in 2010 would be nice. Closing some loopholes in financial systems that are letting people pay way too little for some taxes. That would also be some ways to at least get the ball rolling and actually create some lower issue healthcare is that like Obama's proposing.
So now, Andrew, would you agree that it might be a good idea to, for example, roll back the Bush tax cuts or just to let them expire in order to help us cover the deficit?
No, I don't. When the Bush tax cuts were enacted, federal revenues actually were record levels of, when we rolled back taxes, we actually gained more revenue. It's, for people who have taken basic economics, it's the Laffer curve notion that there's an ideal level of taxation where above that you lose revenue and below that you lose revenue. And right now it seems we're on kind of the high side where if you cut it just a little bit more, you could probably get more revenue. The question is, if you're going to raise taxes, where's that money going to come from? Because right now the top 2% of wage earners in America pay over 50% of the country's tax burden. The top 50% of wage earners already pay 80% of the tax burden. So eventually, if you keep taxing them and taxing them and taxing them, eventually you're wiping out that base, or at the very least taking away any incentive for them to gain that next dollar, because they're just going to have to pay 80 cents on the dollar for taxes the next one they make.
Kyle, are we taxing the rich too little in this country?
I think we're getting into a lot of quibbles. We're probably getting into the libertarian issue about you are your own man, you make what you want. The projection is that if you do let the Bush tax cuts expire, you're going to get $140 billion a year by 2012 in generated revenue, which I think we can use to substantially fund this healthcare issue imperative we're looking at. Are we taxing the rich too much? You know, it's a good question. I don't know. I actually don't know the answer, because that's really more philosophical than anything. Like, what is too much? What are people willing to give? The majority of Americans do support the universal healthcare system, and the majority of Americans support paying more taxes to create a universal healthcare system. This is really up to the constituents, up to the people.
Okay. Now,
I want to address something he said there. Twice so far he has said the majority of Americans support universal health care. That's not true. The polls show that a majority are against it, and in fact, if the majority were for it, the Democrats would actually be able to pass it. They have a supermajority in the Senate. They have a majority in the House. They have a Democrat president. There's absolutely nothing the Republicans can do to stop it. However, the Democrats haven't done it because they know it's going to lead to huge electoral losses. And in fact, Investors Business Daily did a study that 2/3 of doctors don't want this. And yet we're supposed to believe this is going to be a good thing that everybody wants.
Kyle, that's kind of an interesting point. If there's a lot of public support for universal health care, and the Democrats have pretty big majorities in both the House and the Senate, and they have a Democratic president, then why isn't this being passed? Why is there so much trouble?
We're getting back to that grassroots issue, the issue we initially brought up of fascism. This pushback honestly has taken all of us off guard. We didn't expect that this grassroots movement was going to be as intense as it was, and this is really causing the major rift.
But if the grassroots is such a small percentage of voters, then why don't the Democrats push ahead with this?
It's simple. Once you start the spark going, if you've got the oxygen to create the flame, you've got the flame. This initial grassroots movement, I think, has just started to go out of control, and people now believe some of the crazy shit that gets said out there, like death panels, for instance. It's just getting so out of control. People begin to believe some of the falsehoods, and that starts to foster discontent. When you've got that, fuck, it's over, man.
Yeah, now, of course, we've been talking a lot about the conservative grassroots movement, but there's also, interestingly enough, a liberal grassroots movement that's ticked off at Obama for not putting single-payer on the table. So, Kyle, do you think that single-payer is an option that should be considered?
Andrew's not gonna like me so much. Yeah, I'm an advocate of the single-payer. I guess I'm not as militant as like Bill Maher is on this, who's obviously throwing his own feces at Obama for not putting that out there. But yeah, I'll just end. I'm for the single payer.